Hi, my name is Melanie Godfrey, and I will be doing the article summary. The article we chose is Adolescents with Gender Dysphoria by Peggy T. Cohen-Catenes, PhD and professor, and Daniel Klink, medical PhD and pediatric endocrinologist. This article covers research and treatment of adolescents with gender dysphoria, and I will start with this quote from the article. Awareness about one's sex and gender evolves gradually in childhood. When growing up, children learn to classify their own and others' sex, and they increasingly develop an understanding of the various aspects of gender. Gender identity consists of the ability to classify oneself and others as male or female. Most children will identify with the gender they are assigned to at birth. Others will identify and show behaviors and preferences for a gender they were not assigned to at birth. This sometimes can become a strong dislike of their physical sex characteristics. If the distress results and extends to clinical levels, a diagnosis of gender dysphoria is applicable, according to the Diagnostics and Statistical Manual of Mental Disorders, the DSM-5, by the American Psychiatric Association. An important note is that children who only show gender variant behavior do not fulfill the criteria for a gender dysphoria diagnosis. Another important note is that not all individuals who experience gender dysphoria necessarily experience a complete cross-gender identity, or want hormone therapy, or want surgery, or want to live their lives as the other gender permanently, and some do not need medical or clinical attention at all. Puberty suppression and gender-affirming surgery. After meeting qualifying benchmarks, gender dysphoria youth can receive puberty-suppressing medication, later followed by cross-sex hormones. These are sex steroids of the experienced gender. If they achieve additional benchmarks, they may have several types of gender-affirming surgery as well. The article talks about the standards of care of World Professional Association of Transgender Health, WPATH. These 4 criteria are the minimum that a candidate for puberty-suppressing hormones would need to meet in order to qualify to take the suppressing hormones. So, 1, the adolescent has demonstrated a long-lasting and intense pattern of gender nonconformity or gender dysphoria. 2, gender dysphoria emerged or worsened with the onset of puberty. 3, any coexisting psychological, medical, or social problems that could interfere with treatment have been addressed, and the adolescent's situation and functioning are stable enough to start treatment. And 4, the adolescent has given consent, and when in cases where the adolescent has not reached the age of medical consent, the parent or other caretakers or guardians have consented to the treatment and are involved in supporting the adolescent throughout the treatment process. Research and studies. No formal epidemiological studies on gender dysphoria in children and adolescents up to 15 years of age has or does exist at this current time. Additionally, there are not many studies that exist on the determinants of gender dysphoria. The article goes into some of the studies, and one of the latest studies have been a focus of research has shifted towards histological and brain imaging studies on gender dysphoric subjects. The studies were based on the hypothesis that brains of individuals with gender dysphoria do not follow the line of sexual differentiation of the rest of the body during prenatal development, sex atypical programming then occurs. And another study that has been done is on heredity, seeing if it is something that you can inherit through your genes. So heritability studies provided a base for genetic factors contributing to the development of gender dysphoria. The search for candidate genes have hitherto been focused on genes involved in sex steroid synthesis or in sex chromosomal aberrations. The results of both of these studies to this date have been deemed inconclusive.